Hello, my name is CzajkaK and welcome to my poster presentation on the signs and symptoms of oral candidiasis associated with health factors and resistant candida infections in a Northern Ontario cohort. I have no affiliations to declare, and this poster session has received financial support from the NOEMA AFP Innovation Fund, the NOSMU Faculty Association Research Development Award, the NOHFC Internship Fund, NSERC Discovery Grant, and the Northern Cancer Foundation in the form of educational and research grants. Infection-causing Candida fungal species are commonly present in the oral cavity of healthy adults with no adverse health impact. However, this can become a highly pervasive infection in older adult, immunocompromised, and palliative populations. Oral candidiasis results in things like local oral pain and discomfort. It can lead to secondary complications and an increased risk of mortality. Some Candida species have also evolved intrinsic antifungal resistance, or strains can individually acquire antifungal resistance. So the signs and symptoms of oral candidiasis, commonly known as thrush, can present as either a pseudomembranous or an erythematous infection, and the signs and symptoms include dry mouth, taste disturbance, burning mouth, angular cheilitis, removable plaques, and oral redness. The objectives of this study were to 1. Assess the impact of medical conditions and frailty on oral candidiasis and its signs and symptoms, and objective 2 was to assess if any of these signs and symptoms could serve as indicators for a candida infection, especially an antifungal resistant one. Participants were recruited at the Northeastern Cancer Center Dental Clinic, or the Health Sciences North program. They were aged 65 years or over. They had 2 mouth swabs taken, one at the initial visit, one at the 2-week follow-up. They were usually prescribed the first-line antifungal treatment of fluconazole, and they had at least one oral candidiasis sign or symptom present at this initial visit. Participants were also surveyed to collect various demographic data, including the clinical frailty scale. And the signs and symptoms of oral candidiasis were recorded. And if the infection was not resolved at the 2-week follow-up, then an alternate antifungal had to be prescribed. The 2 swab samples retrieved were processed by the HSN microbiology lab, and fungal culturing and the Vitex species identification assay was used to identify the yeast species present. For the results, participants had individually different complex medical histories, where the most common comorbid conditions were high blood pressure and diabetes. And no one factor in the statistical analysis increased the odds significantly of the infection being unresolved at the follow-up. For the symptoms and fungal surveillance, almost all participants had dry mouth, about half experienced taste disturbance, and about 40% of patients had burning mouth, angular cheilitis, oral redness, or removable plaques, while coated tongue was present least frequently. For the statistical analysis, it was found that oral redness or angular cheilitis indicated an increased significant odds that the infection would be unresolved at the 2-week follow-up, while presence of coated tongue suggested a statistical likelihood that the infection would be resolved at the follow-up. So, to conclude, many older adults, patients susceptible to candida infections will have a complex medical history, and the range of health factors needs to be considered on a case-by-case basis, in addition to the signs and symptoms present. And candida infections do not all present uniformly, as demonstrated by these varying combinations of signs and symptoms. And pseudomembranous infections, which is shown by coated tongue, may be easier to diagnose and treat, while erythematous infections with signs like oral redness and angular cheilitis are more difficult. So future studies should consider a more holistic approach for studying the oral microbiome, which may reveal the bigger picture of what's happening and other organisms involved in maintaining normal floral homeostasis, and more molecular diagnostic tests are needed at the clinical point of care to better accurately diagnose Candida infections. Thank you for listening.